So hello, my name is Don Tatalovich. I'm the owner here at Cornerstone Dental Center. And one of the questions I'd like to address today would be, how can an implant help to prevent bone loss? So when a person loses a tooth, a space is created. We have an area where the jawbone doesn't have anything stimulating it. And so we can see, it's called resorption or bone loss happen in that area. So for a patient that chooses to have an implant placed in that area, now we've placed that tooth, function can happen there in that area on that ridge or of your bone, your jawbone, and that will stimulate that bone to stay healthy and strong in that area. So why is preserving bone important for overall health or long-term health in your mouth and of your jawbones? So when we lose a tooth in an area, a space is created, and that area will no longer receive stimulation like pressure from chewing. When we let this progress over time, the body will resorb or take away that unused bone. So placing an implant in that area will allow chewing to continue in that site or that space, which will preserve the bone on the ridge there. So how does that impact somebody's appearance? With bone loss and the tooth loss that preceded that, what we see is the cheeks and lips are often not supported as well. And this can cause, with the resorption of that bone in your jaw, this can cause a sunken appearance or kind of a sagging look to your cheeks and lips. How does implant placement help with preservation of bone and stability? So we've kind of already talked a little bit about once we lose a tooth, we have a space that's there, and resorption will happen over time if we don't replace that tooth with something to stimulate the bone to remain as it is. And so once we place an implant there, those chewing forces on that ridge will preserve or encourage that bone to maintain its height and width there, to maintain the volume of bone that's there. The benefits of that would be that we're also going to preserve the bone, that resorption process won't progress to the adjacent teeth. And then another concept which we would want to consider is having a full complement of teeth is going to result in something called mutually protected occlusion, where you have more teeth to do the chewing rather than focusing all of that force on a smaller number of teeth. So just recently I spoke with one of our patients who was in the office. She talked about an implant we had placed a couple years ago, and we talked with her about just kind of how that had impacted her. And she was telling us that she actually felt quite a lot more confident smiling, knowing that there wasn't risk of exposing a space in her smile. And so she was just really excited to share that with us. So what's a misconception that I hear or that patients might have about implants and bone health? And so I think that a lot of times we have a tendency to talk about health of the teeth themselves and how to replace teeth, but one of the things that we don't consider is the bone beneath teeth or the implants. And so preserving bone, we're preserving the supporting tissues beneath the teeth. And so when we're addressing a missing tooth in a space, a site where the tooth has been lost, we're also addressing the bone health and the health of the adjacent teeth as we protect those adjacent teeth by providing more chewing surface and preventing bone loss in the areas around those other teeth as well. So if you have an area where you're missing teeth, or we have concerns or questions about, we have a space where a tooth is missing or might be missing in the future, and the aesthetics, facial support of your cheeks, what's our next step? Please give us a call, come down to the office, and we'll take a look at your teeth and your gums and your mouth, and we'll kind of talk with you about your goals, and we'll figure out what your specific situation, what your options are for treatment, and figure out what your next steps are.